Just in the past hour, we learned 31 more residents at the Life Care Center in Kirkland have tested positive for the virus. The state health department reports 162 confirmed cases, which may or may not include those new cases from Life Care. We've also learned that 70% of people who tested positive in our state are 50 years old or older. The Department of Health reports 22 deaths from COVID-19. However, tonight we just learned of a 23rd death not yet reported to the state, a person at Overlake Hospital.
We have team coverage tonight covering all angles of the outbreak, but we start with Michelle Esteban at Life Care Center of Kirkland with more on those new cases. Michelle?
Well, just staggering numbers out of here tonight. Out of 30 results that are back, we know 31 residents here have tested positive, 1 negative, 3 inconclusive, and what that means is that will entail further testing, and 20 tests for residents are still outstanding. So we're waiting on those numbers. One family whose mom is here told me that she definitely expected her mom would test positive, but hearing the news still came as a shock.
When my sister and I got it, it was kind of like getting a sucker punch, you know, even though we knew that the reality is no words.
Carmen Gray's mom, Susan, been recovering from knee replacement surgery here at Life Care Center of Kirkland. Now her family says she's the latest COVID-19 patient at the facility.
We found out last night that she actually tested positive.
The facility confirmed the news in their briefing.
She's sick. She's got a cough. It's got her really tired.
She visits her mom every day, but not in person. The facility is under quarantine. She's looking out the window right there?
Yeah.
It's how they see each other through Susan's bedroom window at Life Care.
Outside the window, they wheeled her up to the window and we spoke on the phone. So it was very nice.
Grace says the nursing staff is excellent, but she's unhappy with what she calls a lack of communication. And she's frustrated that Life Care is still waiting on COVID-19 test kits for its employees. Out of 180 employees, none has been tested. 115 working here, the rest, 65, showing symptoms, are now off-site, self-quarantined.
We would like more kits to be able to test employees.
We're hoping we can get tested today, but our priority was getting the residents tested.
Nurse Kathleen Lombard volunteered to work inside. She says she wants tested, but she has no concerns about her health.
We wear a complete gown over our clothing. We put on a mask on our face and then a shield, kind of like a welder's shield, but made of plastic. A lot of hand washing for a very long time.
So we know with more cases here, help definitely needed here, and the staff says they are getting it from the feds. In fact, there was a strike team here. They were working 3 different shifts, 10 people per shift, including doctors, nurse practitioners, and nurses. Again, 3 shifts per day, every day, 24-hour care here at the facility. We pressed hard on why these test kits are not showing up for employees and could not get an answer to it, but it was clear to me that the folks here are frustrated and they keep asking, as will we. And let me just underscore the stats that we know. 20 deaths, COVID-19 deaths in our county, 19 of them linked to this facility.
Experts say testing for COVID-19 is essential in containing this virus. UDub is trying to help, now introducing a drive-through test site. KOMO's Abby Acone is live at UDub Medical Center to explain how this works. Abby?
UDub has tested 180 employees in the last week. Since its drive-through site opened, none have tested positive for COVID-19 so far. Ultimately, the U hopes that it will expand these tests to UDub students and first responders. Right now, UDub Medical Center employees need to get a doctor's recommendation before doing this test. UDub says the risk for contamination in a drive-through setting may be lower than doing it at a hospital. That's because they don't have to worry about the virus spreading indoors. Medical workers are wearing equipment and masks to protect themselves.
Any employees that have respiratory symptoms, we want to check and make sure that they don't have COVID, but we also want to make sure that we are not passing COVID on to our vulnerable patients.
If you have a higher risk for complications from respiratory infections and have a fever or a cough, call your doctor to see if you should be tested for COVID-19. If you have mild symptoms, the CDC still encourages you to call your doctor, but says that not everyone needs to be tested for coronavirus.
In the wake of those 21 passengers testing positive for COVID-19, some people planning cruises in Seattle are worrying their vacations might not happen. KOMO's Nick Popham reports on what the Port of Seattle is doing to calm people's fears and what a slow cruise season will do to the local economy.
we see them every summer at Pier 91. Massive cruise lines waiting for thousands of people to board for voyages to Alaska and other destinations.
Every time one docks is about $4 million into the local economy over the cruise season.
But this year might look a little different.
Right now, I think it's safe to say that we are exploring all of our options.
Peter McGraw with Port of Seattle says the port was expecting a record-breaking year when it comes to people going on cruises out of Seattle, but COVID-19 is forcing them to take action.
Oh, it is significant, and it is a situation we're taking very seriously.
He says they'll be cleaning and sanitizing areas to ensure everything's safe while following the lead of the government and the CDC on best courses of action. But April 1st is the start of cruise season in Seattle, and coronavirus cases continue to rise, which could negatively affect how many people go on a cruise.
It's probably looking like we will most likely reschedule the trip.
Taylor Fry and his girlfriend booked an Alaskan cruise with Princess out of Seattle at the end of May. With the spread of the virus and seeing what's happening to ships like the Grand Princess in California, he's unsure his trip will go as planned.
What worries me even more is the idea of not being able to get off the ship when it's scheduled to disembark, and then also the possibility of being sent to quarantine.
He says Princess has given them about a month to decide whether to reschedule, but he's hoping he won't have to.
If I can't go until next year, I've got $2,600 tied up that I can't spend on vacations between now and next year.
In Seattle, Nick Popham, KOMO News.